Legal and ethical considerations in testing and assessments in counseling. Assessments are an integral part of the counseling process. Because of this, it is important to have a clear working definition of what assessment means and all that it includes. In this context, assessment is a process that utilizes many different methods and tools and starts with identifying factors about the client that require closer evaluation. The choice of assessment and the application of the results is influenced by the counselor's approach to therapy and the counselor's own experience and beliefs. Diagnosis is a part of the assessment process, and it may be used to develop client goals and treatment plans. However, as we will learn later, diagnosis in the assessment process is often debated amongst counselors. Tests and assessments are often used interchangeably, but tests are actually measures that result in a score that represents the client's abilities at the time the test is taken. This may also be included as part of the assessment process. Now that we have a clear understanding of what assessment means and all that it includes, we're going to take a look at the issues. For our purposes, we're going to look at two sides. Assessment and diagnosis should be part of the counseling process, and assessment and diagnosis should not be part of the counseling process. We're going to start by looking at the reasons why counselors believe that assessment and diagnosis should be part of the counseling process. Some counselors believe that if assessment and diagnosis are neglected or left out of the counseling process, then symptoms of psychopathologies may be neglected. If the counselor does not identify the symptoms of mental health or psychopathologies, then the therapy and treatment plan that are developed may be ineffectual. Counselors are also obligated to determine the presence of disorders for the client's health and safety, but also the health and safety of others. Some states have legal and licensing requirements that dictate that a counselor must diagnose a client as a minimum standard of care. Diagnosis is also required by insurance companies in order for counselors to receive payment and reimbursement for the services and care provided to the client. The use of assessment and diagnosis also helps create uniformity and standards in care when working in a team or with other professionals to provide services and care to a single client. And diagnosis may also have a positive impact on the client and the outcome of treatment. Counselors that believe assessment and diagnosis should be part of the counseling process subscribe to particular models of therapy. Those models may include Adlerian, existential, behavior, and cognitive behavioral therapies. Now we're going to look at the reasons for the argument as to why assessment and diagnosis should not be part of the counseling process. The first reason is that the focus is on a small selection of the client's issues or symptoms, and this means that the counselor is not focusing on the big picture. Assessment and diagnosis should also not be used because the counselor may try to find symptoms that fit a particular diagnosis. Another reason why assessment and diagnosis should not be part of the counseling process is because when they are used, diagnosis can cause depersonalization of client issues, which has the potential to create client dependency on the counselor. Counselors may also use a stock treatment plan, which focuses on the disorder and symptoms and not the client. The measures used for assessment are also subjective. There's also bias in assessments, and this affects the results and interpretation. These biases include culture, race, religion, gender, and many others. Because bias does exist in the assessment process, and it also has the potential to create client dependency, it is argued that assessment and diagnosis opposes the ethical principle of justice. Some counseling theories and models that are against the use of assessment and diagnosis includes person-centered therapy and Gestalt theory. Now let's look at the code of ethics which apply to testing and assessment. Since there are many different codes which apply to this topic, and many of those codes overlap, we are going to focus on Section E of the ACA Code of Ethics. Section E covers evaluation, assessment, and interpretation. The first code is E1A. This code states that the primary purpose of assessment is to gather information regarding the client for a variety of purposes. This may include client decision-making and developing a treatment plan. Code E1B covers client welfare and states that counselors do not misuse assessment results and interpretations. E2B is the appropriate use of assessments. Counselors are responsible for the appropriate application, scoring, interpretation, and use of assessment instruments relevant to the needs of the client. E2A, limits of competence, states that counselors use only those testing and assessment services for which they have been trained and are competent. E3A is the explanation to clients. Prior to assessment, counselors explain the nature and purposes of assessment and the specific use of results by potential recipients. The explanation will be given in terms and language that the client can understand. Essentially, the counselor must explain what the assessment is and why it is being used. Along with this, the counselor must use language that the client will be able to understand in the explanation. Code E5A, proper diagnosis, states that counselors take special care to provide proper diagnosis of mental disorders. Assessment techniques, including personal interviews, used to determine client care are carefully selected and appropriately used. E5B covers cultural sensitivity. Counselors recognize that culture affects the manner in which clients' problems are defined and experienced. Clients' socioeconomic and cultural experiences are considered when diagnosing mental disorders. E5C, historical and social prejudices and the diagnosis of pathology, states that counselors recognize historical and social prejudices and the misdiagnosis of certain individuals and groups and strive to become aware of and address such biases in themselves or others. E5D refers to refraining from diagnosis. This code states that counselors may refrain from making and/or reporting a diagnosis if they believe that it would cause harm to the client or others. Counselors carefully consider both the positive and negative implications of a diagnosis. For further information on the ethical codes which apply to testing and assessment, refer to the American Psychological Association's Code of Ethics 9.01, Basis for Assessments, 9.02, Use of Assessments, 9.03, Informed Consent in Assessments. Additional ACA codes of ethics which apply are E.8, Multicultural Issues, Diversity and Assessment, and E.9A, Reporting. MBCC codes include Code 25, 26, 33, 34, 35, 48, 49, and 50. Now let's look at some relevant research that has been done on the topic of testing and assessments. In the article, Blending the Clinical and the Cultural, a framework for conducting formal psychological assessment in bicultural settings, the researchers found that in order for an assessment to be effective, that assessment should be practical and efficient, having clarity of purpose, accuracy of procedural content, flexibility of structure, insofar that it can be modified if necessary, and integrity in response to things cultural. The researchers also discussed that universal theories and models should be applied in the context of the culture. This requires the counselor to have knowledge and understanding about the culture. The article also informs us that the absence of universal aspects within a culture should not be assumed to be an issue. This means that it should not be assumed that all cultures exhibit the same behaviors, and the absence of behaviors that are perceived as normal should not be considered an issue without further exploration. This study is a meta-analysis of bias in assessment and treatment. This article discusses the major bias in testing and assessment and how it affects the counselor and the client. One interesting point made in this article is that bias against racial and ethnic minorities are present even after social demographics are controlled. The article also makes an important point of pointing out that a counselor's bias affects the assessment process and the counselor-client relationship, which in turn affects the client's opinion and feelings towards counseling. One of the most important points that the article makes is that there are two kinds of bias: over-pathologizing and minimal bias. Over-pathologizing is when cultural behaviors are assessed and diagnosed as mental illness. Minimal bias is when symptoms of mental illness are assessed and contributed to cultural behavior. Another research study found the counselor use of assessments. In this study, researchers conducted a study that found which assessments were used most frequently among counselors. Along with this, the study found that the most frequently used assessments are used within a wide range of specializations. The results of the study imply that standardized testing measures may not be being used appropriately, since the same measures are being used across specialization. The research also found that although counselors use these select few assessments, they are using them much less frequently. Now let's look at some scenarios in which the ethics of testing and assessment are in question. In this scenario, a student has lived in the United States for 2 years, attends a public school, and is enrolled in classes for English language learners, or ELLs. Despite several attempts, the student has not met the state-mandated English reading and writing requirements on the standardized tests and is no longer eligible for a language waiver. A teacher brought the student to the attention of the school guidance counselor out of concern after learning the student is not able to read or write his or her native language and home language. Based on the teacher's report and the student's test scores, the school guidance counselor decides the best course of action is to refer the student for assessment of cognitive and language abilities. In your opinion, what are the legal and ethical issues concerning this situation in regard to testing and assessment? In the next scenario, a counselor is conducting the first session with a new client. The client is a young, married male and a new father. One of the issues that the client is reporting is that he is recently unable to focus and complete tasks, especially at work, where the client must meet strict deadlines. The counselor decides to have the client complete an interest inventory and informs the client that this will help formulate a treatment plan. After interpreting the results of the assessment, the counselor comes to the conclusion that the client's issues are a result of a career that is a poor fit and is the cause of the onset of mild anxiety. The counselor formulates goals and a treatment plan to begin implementing at the next counseling session. In your opinion, what ethical codes did the counselor neglect or violate in regard to testing and assessment?